I have been a caregiver for my mom for over a year. When she moved with me, I did not know all of the health issues that she currently had. She has had diabetes for over 25 years. I did not realize how much being a diabetic would affect your kidneys. She shared with me that she had kidney trouble. I didn't really understand what that meant. Upon her moving with me, I had to find her a new primary care physician, a renal doctor, a cardiovascular doctor, and several other specialists for all of the health issues that she was facing. It wasn't until I took her to her renal doctor that I found out that she was what they consider stage 3 chronic kidney disease. Hearing the doctor say that her kidneys were functioning at 25%, the first thing I thought about is just, what does this mean? And honestly, I must say I thought about even like death, because I was a caregiver for my son and I watched him decline. And so I'm also being a caregiver for my mom through this lens and wondering, like, what does this mean for her? What kind of care is she going to have? I just started asking questions like, what kind of treatment is this a treatment thing? I had never been around anybody with chronic kidney disease. Like, what does this entail? I had absolutely no idea. And so he went on to explain that once her kidneys reached 15% function, that she would have to go on dialysis. I knew enough about dialysis that I knew it was very high maintenance process. That's all I knew. And I was like, oh my goodness, like how is this going to even affect not just my mom's life, but my life? Because I juggle taking care of her in between a very demanding job as well. I honestly think that I don't even realize how much stress I've been under, because I'm constantly pushing the pedal go. And when it comes to my job, I'm always thinking I need to show up there and not allow what I'm doing at home affect my job. I'm rising up extra early, I'm going to bed extra late, because sometimes during the day I may need to take my mom to a doctor's appointment, so that takes hours away from maybe me executing something on my job, but then I'm staying up late to get it done. I think that it can put wear and tear on you in a way that you just don't realize that you're not catering to yourself. I think when I actually sit down and be still and start thinking about it, that's when the tears come out, because I think I am stuffing the emotions and the stress of feeling like I have to show up for my job and I have to show up for my mom. It's important for me to be there for her and give her 100%, because one, she raised me, and I believe that she gave me her 100%. When I look at how frail she is, and I just think about the cycle of life, it makes me just think about how I have the privilege of helping her in her frailty as she helped me in mine, though I was just a child. And honestly, I'm very grateful that she's still with me and that I'm able to care for her despite the challenges of the stress and a lot of times feeling overwhelmed. I think the emotions that have come up during the time that I've been her caregiver, I have seen her break down at my kitchen table crying and saying how tired she was because her diabetic number kept dropping. That made me feel helpless, and I tried to comfort her, but also just acknowledging to her that I did not know what it felt like to be her, because I felt like that was a good way to show empathy. I've seen a lot of fear. She started talking to me about when she leaves and what's on the other side of death. I didn't know how to give her peace about it. Some emotions that I've dealt with besides helplessness is that I've felt frustrated. I've found myself sometimes getting short a little bit with my mom, and it wasn't really her, it was just life. I was just tired. When you're constantly pushing yourself to show up for all these external things and people that have a demand and need you, I'm not really sure why frustration begins to arise, but you begin to get frustrated. I felt myself feel very sad. Just the other day, I'm so grateful to have overheard this call. A nurse called my mom that was a kidney nurse, and it was something that her insurance paid for. I didn't even know this existed. And so I'm like listening to their conversation, and the kidney nurse was asking her all these questions about, like, did she know, where her kidney function was? What was the last things that the doctor told you about your kidneys? She began to ask her, did she have any understanding about dialysis? And my mom was like, no, I don't know anything. I don't know too much. I've just heard that it's a lot of appointments that you have to go to. And so then the nurse proceeds to talk about what it's like to get dialysis, and even talk about her choices, that she can get home dialysis versus going into the clinic. And as I'm sitting there, tears begin to come out of my eyes, because I'm realizing how much this is about to be a life change. That was just a moment of sadness that it made me feel, because I know that her life is about to change. As the time nears for her to have to take dialysis, what also goes through my mind, I think about, is she going to decline really fast? Her doctor said that some people last 20 years on dialysis, no problem. Some people decline really fast. My mom asked her renal doctor one time, how long do people live once they start dialysis? And he said, maybe maximum 5 years. And, I knew that that's where her mind was at, was about her life, how long, she would have left. And so those type of things, because I'm her oldest child and I'm carrying the bulk of the responsibility of being her caregiver, is what's on my mind. And I honestly almost feel like I'm like bracing myself for the good or for the bad, emotionally, primarily. It's very important to have a community as a caregiver, because one, it can be very scary, especially when you're concerned and worried about obtaining the best information to be able to take care of your loved one. Chronic kidney disease is not a new thing. So there's plenty of people out there that have experienced this, are experiencing this, are taking care of loved ones. And if I can connect with people that are 2 steps ahead of me, to be able to say, hey, Rose, this resource is available, or hey, Rose, this is what I did, and maybe this can help you in your situation, that would mean a lot. I wish there was a central hub for caregivers that are taking care of loved ones that are facing chronic kidney disease. The more information that you have, and that it's easy to access on a daily basis, the better. The advice that I would give someone starting out being a caregiver is ask a lot of questions. Ask the primary care physician a lot of questions. If you're going to a specialist, ask a lot of questions, and do your research as much as you can. Throughout this entire journey, Google has been my best friend. Google or ChatGPT, because I know I'm not the medical professional, and sometimes I need quick answers. Reach out to organizations that may have some type of connection or specialty with that type of disease, and ask them for more resources and information. Because the more information you have, the more you are empowered to help your loved one. One thing that I would say I have learned about myself during this journey is how flexible I am as a person, and how much I love, how much I think that the journey has made me selfless. I'm not gonna say I was just selfless by default or a loving person by default, but being a caregiver, it makes you empathetic. It makes you very empathetic to others. My name is Rosemary Sherrod, and I am now included.